Good evening, Professor Carroll. My name is LaShonda Robertson. For my final project, I've chosen to explore the cardiovascular disease, congestive heart failure. I've chosen this topic because it impacts my family personally. So many people think that congestive heart failure only applies to elderly or obese individuals. That's even what I thought. So when my husband was diagnosed 3 years ago at the age of 39, I was at a loss for words. My lack of understanding for this disease left me with many emotions and even more questions, and that's when my research really began. Although education and of signs and risk of congestive heart failure seem to be everywhere around us, many people fail to realize how serious this condition really is. According to the CDC, more than 6 million adults in the U.S. have heart failure. And while this disease is most common for ages 60 and older, it can affect people of all ages, from infants to the elderly. A few of the other statistics: approximately 550,000 new cases are diagnosed in the U.S. each year. Almost 1.4 million persons with CHF are under 60 years of age. Heart failure is responsible for 11 million physician visits each year and more hospitalizations than all forms of cancer combined. It also costs the nation an estimated $30.7 billion a year. Heart failure contributes to approximately 287,000 deaths a year. Deaths from heart failure have decreased on average by 12% per decade for women and men over the past 50 years. So before we dive into the disease, let's briefly look at the heart itself. The heart is a very important organ of the human body. The main job of the heart is to move blood throughout our bodies. Deoxygenated blood enters the right side of our heart, moves through the pulmonary arteries, and is carried to the lungs to be oxygenated. It then moves back through the pulmonary veins in the left side of your heart and is ultimately distributed throughout the rest of our body. Heart failure is essentially when this process is not happening the way it's supposed to. And this is what brings us to the heart of my presentation: the purpose. I would like for my research to educate people about the causes of heart failure, as well as its symptoms, diagnoses, and treatments of this life-altering disease. It is also important to know lifestyle changes such as what you eat, how active you are, and even stress alleviation that can assist in preventing heart failure. For those of us that have unfortunately passed the stage of prevention, it's essential to know the ways of managing this disease in order to help you or your loved ones live a full, productive life. So what is congestive heart failure? It is a chronic progressive condition in which the heart muscle is unable to pump enough blood to meet the body's needs for blood and oxygen. Heart failure can occur in your left side or right side of your heart, or in both, which is biventricular. There are two main subcategories of heart failure: systolic and diastolic. Systolic heart failure is with reduced ejection fraction, weakening and smaller muscles with enlarged chambers. It's also considered to be a contraction issue. Diastolic heart failure is with preserved ejection fraction, larger heart muscles which take up more space, causing the ventricle to decrease in size. The heart is unable to fill up with enough blood, so this is known as a filling issue. The causes and risk factors. Heart failure is usually a secondary condition, meaning it's caused by another underlying disease that has affected the heart's cardiac output. The most common conditions are coronary artery disease, high blood pressure, and previous heart attacks. Other risk factors include diabetes, obesity, and sleep apnea. As previously stated, our heart tries to compensate for not being able to meet these needs by pumping faster, enlarging, or even developing more muscle mass. These temporary measures may conceal the problem in the interim, but the inevitability that our heart and body can't sustain will begin to show through many symptoms. Some of these symptoms include shortness of breath, fatigue, swelling in the legs, rapid or irregular heartbeats, persistent cough, swelling in the abdomen, rapid weight gain from building fluid, nausea, difficulty concentrating, and even chest pain if the heart failure is caused by a heart attack. Now, some of these symptoms may individually not give cause for worry, but having more than one should be reported to your healthcare provider. Although these symptoms could be a sign of heart failure, there could also be other possible concerns. This is why we shouldn't attempt to diagnose ourselves, but instead reach out to our physicians for proper diagnosis. So how do I know if I have congestive heart failure and what can I do about it? So once you've notified your physician of your symptoms and they've completed a physical examination, they may move forward with other tests in hopes of reaching a diagnosis. Some of the most common tests include blood tests, chest x-ray, electrocardiogram, and echocardiogram. Blood tests are done to look for signs of diseases that can affect the heart. These blood tests will likely include a cholesterol check, a lipid panel, a comprehensive metabolic panel, and many others. A chest x-ray can show the condition of the lungs and heart in x-ray images. An electrocardiogram, or ECG, records the electrical signals in the heart. It can show the timing and length of heartbeats. An echocardiogram, or EKG, uses sound waves to produce images of the heart in motion. This test shows the size and structure of the heart and heart valves and blood flow through the heart. It also measures ejection fraction, which shows how well the heart is pumping and helps classify heart failure and guides treatment. Overall, the combined outcomes of these tests will not only assist in identifying if you have heart failure, but they will give an in-depth information that allows the physician to classify its severity. They classify heart failure using two systems. The New York Heart Association groups heart failure into 4 categories or classes. Class 1, asymptomatic. There may be risk factors, but there's no current limitations. Class 2, symptomatic with a moderate exertion, but comfortable at rest, so there's a slight limitation. Class 3, symptomatic with a minimal exertion, but comfortable at rest, marked limitation. And Class 4, systematic at rest, and unable to perform any physical activity without discomfort. The American Heart Association and American College of Cardiology uses a stage-based system to identify risk factors and the development of heart failure. Stage A, you're at risk for heart failure but without structural heart disease or symptoms. Stage B, structural heart disease but without heart failure. Stage C, structural heart disease with prior or current heart failure symptoms. And Stage D, advanced structural heart disease requiring specialized treatments. So you've been diagnosed with heart failure. What can you do about it? Heart failure is a chronic disease and will require lifelong management. The type of treatment will of course vary depending on the severity of your condition. This could be as simple as a lifestyle change, including more exercise and a better diet, or as progressive as a heart transplant. There are also times when doctors can correct heart failure by treating the underlying cause if possible. Most patients will need a combination of treatment options. The medications prescribed can service many functions, such as reducing blood pressure, improving blood flow, slowing your heart rate, and keeping fluids from collecting in your body. Cardiac assist devices are used to prevent complications of heart failure. A pacemaker helps control your heartbeat. It's used to prevent your heart from beating too slowly. A ventricular assist device helps pump blood from the lower chamber of your heart to the rest of your body. A defibrillator provides an electric shock to your heart when a life-threatening abnormal rhythm is detected. A heart transplant is needed when people have such severe heart failure that surgery or medications don't help. They will need to have their heart replaced with a healthy donor heart. Learning that you have heart failure can be terrifying and life-shattering news. It can also be the motivation to get your life back on track. You can begin to build new habits, such as eating a heart-healthy diet, increasing your physical activity, tracking your fluid intake, avoiding or limiting alcohol, smoking, caffeine, getting adequate rest, and taking your medications daily. You can track and manage your symptoms, such as your heart rate, daily weight, blood pressure, any swelling, shortness of breath, confusion, or impaired thinking. Get support. Communicate with your family and your friends. Heart failure support groups are out there. There are even heart failure apps called, one specifically is called the Heart Failure Helper, which is an app to help management. And there are many online support communities as well. So before I end this presentation, I would like to briefly go back to my why, my purpose, the significance of this battle for me and my family. My husband's diagnosis of heart failure was an eye-opening jolt that just took us all by surprise. His symptoms started as a cold that he couldn't seem to shake. That cold led to shortness of breath that started when he was active and quickly progressed to an issue when he was at rest. So after weeks of pushing him to go to the doctor, he finally made an appointment to see his primary care physician. He came home that day and informed me that he had received a referral to see a cardiologist and to obtain an EKG. That appointment was scheduled for October 10th, 2019. We went to that appointment with no specific expectations, but with uncertainty of what was to come. From that day forward, our lives changed. The results from his EKG showed an enlarged heart with an ejection fraction of less than 20%. He was diagnosed with advanced congestive heart failure. That diagnosis required him to be transferred to yet another cardiologist, one whose specialty was specifically for an advanced stage of congestive heart failure. He was advised to begin taking his blood pressure daily, monitoring his salt intake. He was also prescribed 3 medications on that day. Furosemide, which is a diuretic. It helps eliminate salt by increasing urination. Spironolactone, which is a diuretic as well as a receptor antagonist, which helps keep potassium levels from getting too low. And carvedilol, which is a beta blocker, which helps his heart and circulation of blood through the arteries and veins. So just to go back to 2 of the main things in his diagnosis. We mentioned his ejection fraction being low. Ejection fraction is the measurement that doctors use to calculate the percentage of blood that leaves your heart each time it contracts. Now, this is just showing a general range for men and women. And as you can see, he was beneath the severely abnormal range. Another thing about his heart failure is it was considered to be chemotherapy-induced cardiotoxicity. Now, what this is a cardiac dysfunction induced by chemotherapy. It may vary from subclinical myocardial dysfunction to irreversible heart failure. And how does this happen? When you have cancer and you go through chemotherapy, these are extremely potent drugs, and they're used to increase survival and lower the recurrence of the rate of cancer, but consequently causing cardiotoxicity. And this may appear early or late after therapy, but early subtle changes of cardiac structure and function are usually not detected through classical echocardiographic parameters. My husband was diagnosed with leukemia when we graduated from high school in 1998. So from 1998 to 2019, the effects of that chemotherapy was weakening his heart through that whole time frame. 1998 to 2019. That is a big gap from going from chemotherapy and leukemia to now having heart failure. So I just wanted to tell you about my family's experience. Just to show that there's no one for all cause, diagnosis, symptom, test, or treatment when it comes to heart failure. Taking care of ourselves should be a priority at every age and every stage of our life. As I conclude this presentation, I would like to thank you for sharing your knowledge and time this semester. I've learned a great deal and look forward to continuing my education with UNC Pembroke. Thank you so much and have a good evening.